Welcome back to Tales from the Lab, a veterinary podcast. As you may have noticed, we've made some exciting changes around here. I am your new co-host, Dr. Brad Ryan, Senior Professional Services Veterinarian at Antech Diagnostics.
And I'm Dr. Holly Brown, a clinical pathologist and Chief Veterinary Educator at Antech. Together, we'll be discussing real patients and bring in expert guests to offer deeper insights into the laboratory diagnostics used to solve interesting and challenging cases.
Tales from the Lab is a production of Antech Diagnostics. The intent of this podcast is to provide education and guidance with the understanding that any diagnostic testing and treatment decisions are ultimately at the discretion of the attending veterinarian within the established veterinarian-patient-client relationship.
Our mental health podcast series is meant for educational and informational purposes only. It is not meant to provide medical or mental health advice, diagnosis, or treatment. If you need mental health support, please reach out to a licensed professional or crisis line.
Content warning. This episode contains discussions on mental health topics that may be sensitive to listeners. We encourage you to take care of your well-being. If you need mental health support, please reach out to a licensed professional or call or text 988 in the United States or Canada.
Let's move into our third and final topic in this series on mental health. And for those of you who are new to Tales from the Lab, I'm Dr. Brad Ryan, Senior Professional Services Veterinarian at Antech Diagnostics. And World Mental Health Day was a few months ago on October 10th. And I had a chance to interview Dr. Jen Brandt, who is the AVMA Director of Member Wellbeing Initiatives, on the topic of boundary setting. But I wanted to make sure that while I had her, that we were able to get a few more episodes out of her because her expertise is so rich, and she's been working with veterinary students and veterinarians throughout her entire career. But prior to joining the AVMA, Dr. Brandt served as Director of Student Services at the Ohio State University College of Veterinary Medicine, which was the era of her life in which I first knocked on her door and we met face to face. And here we are almost a decade and a half later. And the conversations are changing. They're getting more just time in the spotlight, in my opinion. And Dr. Brandt is here today to complete this series on mental health, following up on our previous episodes, which are in our archive on the topics of boundary setting and self-compassion. Today, we're going a little bit more macro, right? We're all doing that work on ourselves, but we also want to walk into our hospital every day and feel like we are part of a culture that really prioritizes well-being. And we want to take a peek at what that looks like, Dr. Brandt. Thanks for being here again. And I hope that by the time this episode ends, we're going to have a much better idea of not only what a culture of well-being looks like, but what it isn't. And what are those benefits of being cognizant of that, working towards that, and then what ultimately can we do as individuals and as hospitals, as teams, to ensure that we have that culture of well-being. So thank you for joining us. But I want to start by asking you, what is workplace culture, and what does it mean if you are, and how do you know if you are working in a culture of well-being?
A great question. When we think about workplace culture, what we really think in its most simplest terms is, how do we do things around here? And I phrase it that way because often when we think of culture, we think it's this thing out there. We don't realize that it's us too. Like what I say, how I interact, is also part of the culture. And so it's how we all daily, go about doing what we do. We often will think that the culture is the posters on the wall or the policies in the binder or the mission statement, and they might be. But often culture is kind of hidden from those formal documents. It's like the real truth of what goes on behind the scenes and how we think about things and process things and interact with each other.
And that we're feeling it. We're living it every day.
Absolutely. But but so many things are, because they're hidden, it's like the hidden, rules of the workplace, the things that aren't said. We don't necessarily notice them or have a language for them or consider them part of the culture because they haven't been formalized. But, for example, if we have an organization that regularly makes decisions only at the top and we don't check in with anyone else, that is the culture, regardless of whether you say we have an inclusive environment or not. In reality, you don't. You have a very hierarchical decision-making structure, and that is the culture. And so sometimes having honest discussions about culture require to really have people dig deep behind that surface and talk about what it's really like, what it's really like to experience it.
You said so often it shows up in the small stuff, right? So it's like almost like death by a thousand cuts, right? It's just like these little things that are just status quo in the way meetings are handled and the way problems are escalated, right? And we don't even realize that that these norms perhaps are counterproductive to and not just counterproductive, but in some cases damaging.
Absolutely. I love the analogy of the death of a thousand paper cuts. When I used to do a lot of consulting, I would go in and again, what I was told about the culture were kind of the things that we wanted people to know, the formal things. But often when you'd start talking with people, for example, it wouldn't be uncommon to see maybe one person on the team acting in a way that was very noticeable, right? Maybe what we would call aggressive, the tone that they used with people. And it was just like this background noise. And so when I'd ask about it, oh, that person's been here forever. You just put up with them. That was the culture, that we're going to ignore this habitually problematic behavior that was causing a great deal of turnover, distress. There were many complaints, but none of that was addressed because the culture was, we're just going to ignore this. And so it really is being able to find the name for all the things that are happening, including the things that we haven't really acknowledged before.
In terms of understanding, like, what is our culture, right? What is the culture?
Yeah. And by the way, that's also very positive things.
Yeah.
I mean, we may not write it anywhere, but we may say this team is really excellent about providing balanced feedback.
Yeah.
And what I often see on teams as part of the culture is that we may have arguments among each other, but when push comes to shove, we really rally around each other, that there's a loyalty and that there's a support, and we are not going to have you go through this alone. And I think those things in the culture are also very important to name.
We've done a good job here, I think, of trying to of framing that, understanding that this shows up in subtle ways sometimes. But at the end of the day, we need to evaluate that, right, Dr. Brandt, and ask ourselves this question of, is our particular workplace culture a culture of well-being? So let me ask you, if you could please, let's define what that is. And I'm sure that there are many nuances to it, but how do you define that? And then can you give us some pillars that you would place underneath that definition so that we know what we're talking about here?
Yeah, it's interesting when we look at cultures of well-being. Of course, it's not just one thing for everybody, right? There would be some customizing to meet the needs of an individual workplace, but in general, we would be looking at principles of equity, not just lip service, but actual equity, transparency. It was interesting. I've worked for organizations where like the leader knew the word transparency and then would say, we're transparent, but I would be thinking, I don't know that word means what you think it means, because it didn't change the information shared at all. So actual transparency, qualified leadership. And so that's looking for people who not only know the job per se, but understand the spirit of managing people well, being able to model vulnerability, having an environment that is safe to do that. Psychological safety would be a key component of a culture of well-being. Celebrating team strengths would be a part of that. Flexibility and autonomy are also a key part of cultures of well-being. And that doesn't mean that everybody gets to do whatever they want to do whenever they want to do it. But like within parameters, having people be empowered and trusted and trained enough to be able to make appropriate choices, even if like that's not the exact way the flow chart, goes. So there's space to work in a way that is healthy for you.
I think it could be very easy for someone, even a manager that's well-intentioned, right, to misconstrue initiatives that are very individual focused, providing that associate veterinarian with maybe an office or a space in the hospital where they can go listen to Enya and have an aromatherapy diffuser going, or whatever it may be. An investment in or 10 free yoga classes or whatever it might look like. And those are great things to be doing from a self-care perspective, right? But that's not addressing the underlying systemic culture, correct?
Correct. Absolutely. I would say in most organizations, when we first started talking about health at all, it was looked at as wellness, and then it might be smoking cessation or blood pressure management, right? And, but we weren't asking what was causing the blood pressure to be so high to begin with. And then that morphed into more individual efforts like you said, yoga or individual counseling, all of which are fine, but none of them are asking the question of what's going on in this environment or, when you're offering a resilience training, again, that might be fine, but I like the question, what the heck are we needing to be so resilient for or about? Those questions, really require more systemic thinking. If that one person is struggling on the job, what are the factors that contribute to it in our environment? Might it be our policies? Might it be our leadership? Might it be, our resources that are available? And so when we look at a culture of well-being, we have to look beyond the individual. Yes, we play a role. We play a role, though, in this much bigger system that has a lot of elements flowing. One of the challenges, though, in thinking systemically is then it starts to feel like the solutions aren't as ready to access, right? They're going to be more complicated. And that is true. It's also necessary to do that work in order to have then the benefit at the individual level and then the team level, and overall the organization wins with those approaches as well.
Yeah. And in researching this episode, the point that I came across that really was an aha moment for me was that, when as well-intentioned as it is to offer these resources and these offerings to try to help individuals build up their well-being and so forth. There may be, if we're failing to actually address the systemic issues, there's almost an implicit message there, like what we're doing is fine, and you just need to work on yourself, right? You need to. They might not be thinking of it like it's your fault, or this is. I'm blaming you for not being tough enough or being able to handle the culture as it is. I don't know if I'm asking that question.
You are. I would say enough. It's in the example that comes to mind, and people will say it's demoralizing, if your organization asks you to do a survey, for example. And so, in that, here's some things that are going well, here are some things that we may want to work on. I've been part of those surveys. I filled them out on my own. I've also been part of review teams that look for it. And, all these challenges might be listed. And then the organization or the leadership might say, we hear you loud and clear. So we are bringing back, pizza day once a month. And it's like, I told you I'm overwhelmed. We need more staffing. I need a pay structure that I can survive on. I need access to childcare. I need mental health resources that are accessible and affordable. The pizza's not going to cut it. And that doesn't mean we're not grateful. Like, pizza's great. It just doesn't make a dent in all of those. And so people will say, I just feel sucker punched. Why speak up at all now? Why bother at all if the only solution they can give is one that isn't a solution, right? It doesn't address anything. Yeah, I mean, that just so commonly takes place. We're just so missing the mark. Or again, a resilience training. I was part of an organization. Well, it was when I worked in academia. And fortunately, I had I thought, very positive relationships with the interns and residents. And they were basically told they had to go to mandatory resilience training. And thank goodness, many were just comfortable enough to speak up. And they're like, Dr. Brandt, we swear to God, if you bring in a resilience training, we are going to punch something. Like, the problem is not that we are not resilient. The problem is that this is not humane, right? That these are not reasonable expectations. And that's what we, come offer a training on that and then have the decision makers sit in on that. I'm like, yeah, agreed. I have no argument with that.
Right. So I want to talk about how cultural norms, including biases, unwritten rules, how do these elements support well-being, and which ones undermine well-being in your experience?
Yeah, the ones that support them are things that we discuss, like the equity,
right,
like the vulnerability, like developing psychological safety. And so then think about the things that don't are some individual contributions as well as culture. Think about the perfectionism that's expected in medicine, the overwork, the stoicism, never let them see you sweat at all. I think, I was certainly raised on, and you were likely raised on, that the client is always right. And that is not true.
And even when you're serving tables.
Yes.
No matter how much you're being abused in some cases by the public, that you've got a manager going out and coddling.
Yes.
And,
yes.
Right?
So many stories about that. I would say what we could say is that we will treat people with courtesy and respect, right? That is the standard.
But the abuse.
Part of that standard then is when that is not happening, we will set boundaries as a team around that. And so there are times when when they're not right and the behavior is not okay. It's not safe for the team. And so, respect and courtesy doesn't mean that we have to tolerate abuse, but somehow, that messaging, I think, hasn't gotten clear. I also think, that we're still working on, we become much better, but having a language and having honest conversations about mental health and wellness and needs in the work and figuring out how we can better do that. We still have some culture around, you got to keep that to yourself, or you're a troublemaker. Sometimes that might be even the reinforcement you get when you do speak up. And so we can do much better about normalizing those conversations.
Yeah. I don't want to because we did a whole deep dive in perfectionism on our second episode in this series. I'll refer our audience back to that episode on self-compassion. But one thing that we didn't hit in depth, that is one of the norms that undermine well-being that you just mentioned, that I don't want to skim over, is overworking. And this culture that I picked up on early, which is that, we do that 60-hour work week with pride, right? That is the sign of a committed veterinarian. That's someone who really lives up to the honor of being in this profession. So many people apply for vet school, didn't get in. Here you are, and you made it through, and now you're a veterinarian and you're practicing. How could you possibly complain about your caseload being so never ending? Yeah.
Yeah, I think, we've inherited values from previous generations that you must always be grateful. And that, first of all, like, maybe there's some things you're not grateful for. But even when you are grateful, doesn't mean it's okay to work myself till I'm unhealthy, right? I can be grateful about setting boundaries. I can be grateful about having a voice and being self-aware enough to know what works and what doesn't work for me. But one of the jokes that I've heard in conferences, and then everybody laughs because they recognize either themselves or others in it, it's almost like a competition for who is, pushing themselves the hardest. It's like, well, I didn't eat lunch today. Oh, yeah. Well, I didn't urinate today. And like, oh, yeah. Well, I wear a diaper now, so I don't even have to take a pit stop. And we laugh in recognition. And right. But we do see that play out as if, again, it's I'm enough. I'm better than everyone because look at all these sacrifices I make. And part of that is an internal process, but part of that is because that gets rewarded from the external environment. Often if you are the one who worked a 70-hour work week, that might put you in a better position for a promotion.
Right. That's what I was going to say.
That might get you more money. And so it's hard. This thing that we're doing, we are being rewarded for,
right.
Maybe in some instances. What we don't tend to be so aware of is the cost that it comes at.
That's the hardest part of this, isn't it? Because there is, at the end of the day, everybody wants to advance in their career. Everyone wants to make more money, have more benefits, et cetera, right? And so the idea that if I set that boundary, if I push back on that, I don't, somebody else is going to use that against me as a competitive advantage for themselves because they are willing to work until 9 p.m. When technically the hospital closed at 6, right?
Yeah, absolutely. And I'd say sometimes doing the healthy thing for you and modeling the healthy thing, again, still may come with a cost. That person who didn't have the same needs and, maybe the way they can work will be rewarded differently. And that can be tough. It's like taking care of myself, must it come at such a cost that I lose out on everything? And that's, again, where we start to look at the culture. What is it that we say we reward if it's well-being, and what do we really reward? One of the things I can share with you, this was not a formal study, so I want to make that clear. But I underwent the process of looking at maybe 100 mission statements, just randomly around the nation. Mission statements mission statements for veterinary organizations and practices. And inevitably, they all shared some of by the way, written really well. This isn't a criticism of how they were written. Inevitably, they said the same things, though. It was about the focus on the patient and bringing the best evidence and promoting animal welfare and, doing right by the clients. No concerns about that. But in 0 of them did I find staff well-being listed. And I think if we really want to have cultures of well-being, could we start with naming that, in an overt statement? Which, by the way, having it in the statement also doesn't cause it. We do not have a healthy culture just because we said we have one in our mission statement, but it does start the conversation. What does that look like? What does that mean for this team? How do we make that happen? What are the concrete steps and what are the measurements that we could take that show we are working in that direction? And so I thought that was just an interesting opportunity for the veterinary world as a whole. Could we start looking at where we are overtly stating that this is what we are aiming for?
If we're getting there, if we're working towards that end, and we've actually implemented these changes and we've fostered this culture, what are the benefits and outcomes, the tangible benefits and outcomes that we're going to see as a result of that concerted effort being put towards this?
Like so many things. I think one, staff retention, and what a reputation to earn, like when people are out talking about how amazing it is to work here. Not that it's easy, because this is hard work, but also how enjoyable it is to be part of this crew. So I think about recruiting people as well and drawing people in. We know it improves or strengthens belonging on the team, and it can improve equity across roles because we're having these discussions. It allows more, instead of this person must fit this environment, allows the environment to more be asking what allows this person to thrive. Sometimes we have these job descriptions that I don't even know, who they fit. You might need 4 people to do all this instead of are we suited? Are we stronger in certain things that we could do? And so there's a little more, customization to what we each can offer. It improves trust and everyday communication among team members. Again, can you imagine if we're all striving for this thing where every one of us can thrive, so we're not treating it as this limited resource that only a few can get and benefit from? Also, just the thought that well-being is the culture. It's not this one add-on that we do, like a pizza party or, flavored waters. Like it's now in our bones and it's in our DNA. It's how we ask questions. It's how we make decisions. Like it's an essential part. And I don't know that I've seen an organization that has all of that, but I have seen many who are really making big strides toward that.
Right. And I was going to ask you this in both of our previous episodes, and I didn't. But we've at the end of the day, we always come back to ourselves, right? What's my agency in this pursuit of boundary setting, in this pursuit of self-compassion, cultivating that, as well as showing up at my hospital and wanting to be that agent of change for the culture at large, right? So that's once again, like we have a lot more control over ourselves than we do an organizational structure and a culture, but we do have a part to play, right? And trying to set that in motion, right? So and in some cases, like maybe the culture is just clearly not going to change, right? And so then we have to come back to us and say, what am I going to, where's my place in this hospital? And it might be that there is not one, right?
Yeah, absolutely.
But where there is, if we're starting to see some traction there, what are the things that you're looking for?
So I will just say like a caveat that these conversations really are complex. When we first started looking at well-being, it was only on the individual level. Now we do have systems conversation, but somehow through that, the concept that you are mentioning that's really important, that personal agency, we somehow forget we have that, because it's the system, it's that thing out there, but we are also the system. And so personal agency really is important in terms of individual well-being, but also for the whole team. So I just wanted to say that, the individual level, I just think, whatever a starting point is for somebody, for a person, it may be, I'm going to start to say, I am at capacity now. Right. Just to model that and then hold that for you as an individual, that may be the appropriate. And I think even before a public statement like that might be made, it might be really sitting back on your own and reflecting or talking with a good friend or a therapist or a coach, like what aspects of this work really are for me. What am I forcing to be, and then what kind of conversations can I have around that with my employer or my team? It's okay to say I don't like all of it. And they're right. So some of it's just being honest with ourselves. And then with that information, I like to say, what's the next tiniest baby step I can take that is in a direction toward that? So it doesn't feel so overwhelming. I would say in terms of a team, again, some teams will start with maybe a survey to get a handle on really what do people say is and isn't working. I'm a big believer in surveying and collecting data when it's anonymous and safe. A challenge is we can't just survey and do nothing with it. There has to be a commitment to follow through. So if you're doing a survey, have a very clear plan in place. Here's how we're going to tabulate it in this time frame. Here's how we're going to report it out. Honest conversation that, we've gotten the feedback. Here are the themes that we have found. Here's some of the things that we are going to be able to do something about right away. And this is what it looks like. Here are some of the things that we will not be able to address right away. Like, don't avoid it. The people took the time to give you the information, at least address it in some capacity. And then before you address it, also know that the key decision makers aren't just the people who've have been given the most power. Before you implement changes or start brainstorming, everybody has a voice at the table. There are different perspectives. So often in cultures, we see a decision made at the highest levels having no understanding of how that will actually ripple effect, what that actually means in terms of change for the team. But you will get that insight if the team is present for these conversations. So these aren't, at the systems level, we're not talking about necessarily easy, quick fixes, but beginning the conversation, being very transparent and honest, having a clear plan, coming back with very tangible steps about what we will do now. The time frame for doing that can all contribute to more change over time.
All of this has been so hugely valuable, I think, for me personally, and I know it will be for those who are listening. This has been a really rich 3-part series, and I want to thank you for hanging in there with me through all 3 of these episodes. I as we wrap this up, if I could just close this in 30 seconds to a minute before we part ways, I'm always curious about when I'm talking to you. I'm always curious, like, what your own personal observations are in terms of the evolution of these topics over time. Like when you started your career versus when I showed up at your office 10 years ago to now, what are the things that you've witnessed that give you the most hope?
First of all, I love that you asked that question. I really do, because when you're in the moment day by day or decade by decade, in my case, it feels like change is so slow or that nothing has happened. And yet when I look back to at least my early days, right, and what I perceive as the early days for the profession at that time, there were no conversations about well-being at all. In fact, like, you weren't really even allowed to mention the word at all. Just no conversations about that. Even when I was hired, people had no idea what are you doing here? And, so many assumptions about what a social worker would be, that, somebody like that just is here to fire everybody, right? We had no understanding of it. And I think, when you look back to that, and now you think we have embedded counselors at the college level, and professional development programming, and more involvement from everyone on the team. And in the workplaces, the same thing, more and more conversations about systems and leadership training and communication. When you really look at the big picture, it feels like we have made this huge transition. And so I think it's important for people to see that even though it doesn't feel like it in the moment, so many changes have made. Who would have thought there would be national and international conversations about veterinary well-being, and so much engagement and so much investment and so much passion still for the profession. We don't hear about it in the media or, on social media, but I still run into people who say, Jen, have you ever had that dream? You wake up and you forgot to turn an assignment in, and so you didn't really graduate. And I have people say, if that actually had happened, I would go back and do this again. That sometimes the messaging we get can be so not that to be aware that there are so many people who do love the profession and are part of something amazing and beautiful. And, we do not want a world without veterinary professionals in it. So I think more awareness of that, and that we have come so far, and that there's so many opportunities to build on that I do wish everybody could see that.
Yeah, me too. Well, this has been a wonderful 3-episode journey with you. I am so honored that I got to have these conversations with you one-on-one. And I ask for anybody who's listening to this, please share this episode with your colleagues. The way we affect change is one conversation at a time, one mind shift at a time, right? So please like and subscribe to the podcast, of course, but also share this episode with your colleagues. Everybody has somebody in mind that probably needs to hear this today. So let's start there and hopefully wake up tomorrow feeling better for it. So thank you, Dr. Brandt.
Thank you.
Listen to new episodes of Tales from the Lab wherever you get your podcasts. And now you can also watch us on YouTube and Spotify.
Be sure to like and subscribe for exciting new content. Share new episodes with your colleagues and follow us on Instagram at Tales from the Lab. That's TAILS from the Lab. We're grateful you're here.